says it is recording now.
Not yet. Yeah.
Okay, great. Can you see my screen?
Yeah, you can see your full screen.
Okay, wonderful. All right. Selamat sore. Thank you so much for joining me today. So
Yeah.
I'll be providing an overview of the advanced trending, and then afterwards we will go through the NeuroWorks software itself. If you have any questions, you can type into the chat box first, and then I can look at it. And or at the end, you can just speak up. It's fine either way. Okay, so with that, I will begin. So we'll be discussing a few things, which is what is advanced trending, why do we want to trend data, who benefits from this feature, and when can we use and how to use. So we will go into details one by one. So first thing first, we need to understand what is advanced trending. Advanced trending creates a graphical display of the transformed raw digital data from one or more channels drawn on a compressed time scale, which can be customized while analyzing time, frequency, power, and amplitude. For example, a time scale of 6 cm per hour displaying several hours of the raw EEG data on a single graph or page. Trending also provides a single-click access to the data. So the user can quickly navigate to every page in the study and then include or ignore the respective portion of the data for the study report. However, do take note that trending does not provide diagnosis. It's being used to assist the user in focusing to the clinically relevant data. So the analysis of the EEG can be either in time domain or frequency domain. So time domain, it refers to amplitude EEG, envelope, and burst suppression, while frequency domain refers to the DSA, spectral entropy, spectral age, alpha variability, and quantitative EEG. So we will discuss more in details later on. So why do we want our customers to trend data? It's because the tendency of recording long hours of EEG in ICU, LTM, or EMU is quite common. So trending data helps us to reduce the time required to manually analyze the large amount of data. It is useful to nurses, doctors to interpret the EEG data without formal training of EEG. Trending also helps them to assess the clinical state of the patient and identify suspicious or possible seizure events. So trending is a helpful tool to quickly recognize clinically important data segments in all long-term studies. For the trained user, they can also easily identify slow variations of the background EEG activity, identify and quantify specific seizure patterns, and also identify sleep-wake patterns. So many people will definitely benefit from advanced trending. This includes the ICU personnel, the EEG experts, and ultimately our patients will benefit the most. Here are some examples of when we can use EEG with advanced trending. In neonatal, it is commonly used for HIE and IVH. For adults and pediatric, we use it to monitor seizures, traumatic brain injury, stroke, or after a heart attack. So as you can imagine, there are a handful of different ICUs which can be utilized EEG and advanced trending together. So next, advanced trending can be used in various settings. So as mentioned, ICU, sleep, LTM, in the OR and research. However, we will focus more on the ICU setting. Basically, all features in the NATO's advanced trending can be used in neurocritical care, neonatal or pediatric ICU, for different types of cases and clinical indications. So the first trend we'll be discussing is DSA. So DSA displays changes in frequency and power. So this is related to the amplitude changes. DSA can be used in patients undergoing general anesthesia to monitor the depth of anesthesia. And due to its graphical properties, it is also possible to identify sleep-wake cycle, sleep stages, seizures, and to monitor drug-induced coma and burst suppression. So just for your information, DSA, CDSA, and spectrogram, they are actually the same thing with different naming terms. In this DSA with seizures, you can take note of the red arrows. There is an increase in power or brighter color scale, and evolution from lower to higher frequencies along the y-axis. These are actually typical of seizure representations. And in this example, it shows the difference between seizures and artifacts. There is a sudden increase in frequency without any evolution, shown in the orange arrows. So comparing it with the red arrows, which are the seizures, you will notice the pattern is quite different. Artifacts look like a straight line, but the seizures has a gradual change in power. Give me a moment, someone is trying to enter in the lobby. Let me admit the person. Okay. Okay, moving on. Next, we have the quantitative EEG. So quantitative EEG is the quantification of the EEG activity from a multiple electrode recording, typically using FFT. The power spectral analyzer generates data and displays power in various predefined spectral bands, such as delta, theta, alpha, and beta, on a line or area plot. So multiple plots can be used for different bands and display simultaneously. QEEG allows calculating and displaying of total power, absolute, and relative band powers and symmetry trends. You can also analyze spectrum content of a specific area of the brain, for example, the total power in C3 to M2 channel. QEEG also has a flexibility for configuration. For each case use, you can select a single referential or differential channels, or a set of channels, for example, the left hemisphere, the right hemisphere, or you can select a posterior or anterior head region. Okay, give me a moment again. Someone is trying to enter the meeting. Okay. So moving on, the next trend you'll be looking at is the alpha variability. Alpha variability is the ratio of the power in the 6 Hz to 14 Hz band, which includes the alpha range, with respect to the power in a large 1 Hz to 20 Hz band. So graphically displaying the variability of the alpha frequency components over time. The clinical benefit of alpha variability is to monitor cerebral ischemia and brain arrhythmia. So the changes in morphology, amplitude, and frequency correlate with acute cerebral ischemia, and it occurs in the first 5 minutes usually. So EEG abnormalities arise almost immediately when the normal cerebral blood flow declines. So trending alpha variability is useful for early identification of ischemia in ICU patients and to predict vasospasm in patients who have suffered SAH. So in this example, a normal blood flow will show visible alpha variation. Whereas for the patient with decreased blood flow, you'll notice that there is not much changes in the trend over here. So the variations are actually decreasing. Spectral age trending displays the frequency below which X% of the total power of a given signal is located. Frequency below which most of the total spectral power is located, in this case, 95%, it may be configured to other values like 90 or 85%. The clinical relevance of this trending is mainly used to monitor depth of anesthesia and also to predict the presence of cerebral white matter injury, more towards the premature infants. At the bottom image, you will notice that the deep anesthesia result is showing in the lower spectral age frequency. So over here is lower, and over here is awake or normal activities. So these two segments is the awake, and the bottom section is actually deep anesthesia. Spectral entropy trend plot shows the degree of the regularity of EEG activity. Normal EEG activity is usually highly irregular, meaning that the percentage would be much higher. And for dominating frequency often indicate abnormal activity, which will show low entropy percentage. So in this example, you will notice the latter portion of the trend over here. It's in the low entropy percentage, indicating abnormal activity. But in this case, patient is actually in deep anesthesia. So the clinical relevance of this trend is also mainly to use to monitor the depth of anesthesia, though there is some controversy among the anesthesia. Next, we have the envelope trend. So envelope tracks changes in amplitude with a specialized algorithm that helps filtrate the transitory events but give evidence to the rhythmic events. Envelope trend shows an upward shift in the trace in case of a seizure. So in comparison to a standard minimum maximum amplitude trend, the envelope algorithm reduces the impact of sudden artifacts. So this trend allows non-EEG experts to visually identify changes that may reflect seizure activity in the patient and to ask the expert for further consultation. The expert is then able to verify what is happening in the trend by looking at the raw EEG data online and then conduct a treatment and monitor the treatment subsequently. So envelope trend is also time saving for the doctor in the analyzing process as well. because it gives an overview of the seizure activity at a glance in the recording. So this trend is more commonly used for traumatic brain injury patients who may be having seizures. So these seizures are usually non-convulsive seizures, which is patients having seizure without any physical symptoms, which is even harder to detect if you are not using EEG recording. So here's an example of the envelope trend showing seizures with red arrows. It reflects the amplitude in the EEG, which can be ideal to monitor seizures that are long in duration, but not the short and brief seizures. This is another example to demonstrate how an artifact looks like on an envelope trend, which is indicated by the orange arrows. So it is less sensitive, shorter in amplitude when you compare with the seizures that are indicated with the red arrows. Okay, next we will be focusing a little more on amplitude integrated EEG as requested. So AEEG is filtered trending. You don't have to worry too much about the technical details. So broadly speaking, the raw EEG is a band pass filtered and then rectified and smooth. What you need to take note of is the AEG scale. So 0 to 10 microvolt is linear, and 10 to 100 microvolt is actually log amplitude scale. So the minimum and maximum values are trend. So most labs use 6 cm per hour as their time scale, and NeuroWorks offers several time scale to cater to different types of user. AEG is an easy and efficient tool to monitor brain function in ICU. It does not require in-depth scale to learn how to read raw EEG. And to put it simply, AEG uses the standard minimum maximum amplitude trend as illustrated in these images. The blue line refers to the maximum amplitude, while the red line is the minimum amplitude. So this is depicted in the AEG on the right side over here. So the clinical relevance is mainly to detect seizures, especially for neonatal with HIE or IVH. So AEG reviews the background activity, interburst intervals, sleep-wake cycling, and also seizure patterns. So these are actually valuable information to know the overall brain function or the development of the premature brain. So this is more applicable for neonatal EEG, but it is also useful for adult EEG as well. So when we are using EEG in neonates, you need to be mindful of the montages that you are using. It is slightly different from adults and thus affecting the way you configure advanced trending settings. So in neonatal EEG electrode placement, we will modify it from the international 1020 system, which is shown in the dash circles and golden circles. So for neonate, ACNS guideline actually recommends a minimum of FP1, FP2, C3, C4, T3, T4, DZ, O1, O2, A1, and A2 for neonates. So they also include additional extracerebral channels such as respiratory or ECG tracings. So typically, a neonatal EEG is reviewed in a single montage with a combination of single or double distance electrode pairings, such as longitudinal, bipolar, and coronal chains of electrodes. This table shows 3 examples of the neonatal montages, and the ACNS recommends at least 12 cerebral channels. So it is generally agreed that a reduced array is acceptable in premature infants with smaller heads. And the following of the electrodes should be used as a minimum is, as mentioned earlier on. We also observe other labs using other electrode placements like 4 or 8 electrodes. So if your customer has a specific preference of how they want to do recordings in the neonatal ICU, you can suggest these other simplified or modified placements as well. So AEG is especially useful for neonates. So I will emphasize this again. And usually they would prefer to do dual recordings in terms of dual channel recordings. So from C3 to P3 and C4 to P4 electrode positions are recommended because this electrode placement overlay the cerebral vascular watershed zones, or a single channel, which is P3 to P4 only. So the recommended P3 and P4 electrode locations are recommended because they have shown to detect more seizures than the frontal electrodes. AEG is an alternative to conventional EEG to identify seizures. However, AEG will not detect all seizures, and using a 8-channel AEG, it might improve the seizure detection. So next, I will give you more examples so that you have a better idea of neonatal EEG and AEEG. So this is a comparison of the continuous and discontinuous EEG. So on the left image, it shows a continuous background with a sleep-wake cycle in a healthy term infant with 2 channels of raw EEG in the upper panel, and the lower panel is the AEG. And on the right side, it has a discontinuous AEG background with an immature sleep-wake cycle in an infant who has a Danny-Walker malformation at 35 weeks of gestation. This is another example of AEG with indication of seizures, a 4-hour epoch of 2-channel AEG for the patient. So the blue line indicates the first seizure, and there are another 5 more seizures after that seizure, which are marked by the green arrows. So this is a different example. Full-term neonate with status epilepticus. So AEG in a 2-hour epoch with 20 minutes between vertical red lines, and display a 3rd channel P3 to P4 in black. So during the seizure, the lower margin is elevated and the bandwidth slightly narrowed as indicated by the green brackets for the first 30 minutes. And the seizure stops for about 7 minutes after seizure medications, and then resume for about 12 minutes and then stop again. So movement artifact on the left side of the body is indicated by the asterisk. So artifacts and non-seizure movements commonly produce false positive on the AEG, and this must be distinguished from the electrographic seizures. Seizures are generally showing a gradual increase in amplitude, but for the artifacts, they tend to have a sudden increase or shoot up in amplitude, as represented by the arrows. The raw EEG tracing must be reviewed if the segment is suspicious for seizure. This is another example of EEG with AEG in patients who had cardiac arrest or heart attack. So this example illustrated 4 common EEG patterns found in patients after cardiac arrest. So A is flat, B is continuous background, C is burst suppression, and D is electrographic status epilepticus. So the black arrows in the AEG timescale represents the corresponding raw EEG below its AEG panel. So moving on to our last trend, burst suppression trending is the detection of high amplitude EEG segments, which is called burst, and alternating with the very low amplitude EEG segments, that is called suppression. It generates 3 trend plots: burst rate, suppression ratio, interburst interval. So numeric values are available in the heads-up display, while burst suppression trends shows the presence of the burst suppression pattern through the entire recording. As you can see in this EEG recording at the bottom, the burst segment is indicated in blue and the suppression segment is in red. The clinical relevance is usually used to monitor the level of sedation or induced coma in patients. And for preterm neonates, it is also commonly used for the prognosis of cerebral maturation. So real-time values from burst suppression can be displayed on the heads-up display. You can configure it in your analyzer setting to choose which specific channel to display in the heads-up display. This displays the continuous display of burst suppression ratio, burst rate, and interburst interval in the EEG during acquisition. The burst suppression analysis features the elimination of manual counting of the bursts, allowing non-EEG experts to easily understand at a glance just looking at the numbers. This is a 6-hour EEG example in a middle-aged woman with cancer and septic encephalopathy. There is a mild asymmetry with more attenuation on the right side, as shown on the AEEG. And if you look at the A segment, so that's where you can see the difference. And the suppression ratio is also higher on the right side, and the spectrogram at the bottom 2 panels. So nearer to the end of this time period highlighted in the green box, there is a gradual loss of all power and amplitude on both sides. And the suppression is rising to 100% as the cerebral blood flow ceases. So you can see the corresponding EEG in the image C. The EEG is nearly suppressed, showing you a flat EEG in that sense. So by now, I believe you can see that there are many opportunities for ICU and critical care units to make good use of an EEG system with advanced trending. So EEG is not just for neuro department, but also for other departments like neonatal, cardio, and even general medicine critical care. So with some training on advanced training and gaining more experience as you use it, will become a very valuable tool as an ICU monitoring system. So in summary, the EEG is commonly used to detect seizures, monitor AED treatments, and to predict the outcome of the patient. And in addition, advanced trending should be used as a complement to the standard EEG in ICU setting. And we have a more affordable advanced trending package as compared to PERSYS and a wider range of trending features than our competitors. NeuroWorks also have the features to create a use case focused workflow and extensive export tools available for researchers as well. So once again, I'd like to encourage you to be a member of the NTA if you have not signed up. Registration is free. We have video tutorials from our own CAPS team. And we have past webinars and resources on neonatal topics for your further learning. So do sign up for the newsletter for future webinar notification. And this is a recommended reading material if you wish to learn more regarding AEG in newborn. And last but not least, we have brochures and technical specs in the partner portal for you to access and download anytime. So with that, is there any questions?
Wait, I will ask my team first for the question.
If there is no questions, I can move on to the software demonstration to discuss more on the software itself. Let me change my screen. Okay, can you see my screen? My latest database?
Yes, Nina. Yes, we can see it clearly.
Okay, good. Okay, so when we do configurations for trending, we can do it during acquisition or during review. So the first thing I'm going to show you is to do it during acquisition, which is acquiring of the EEG. So we will click new EEG, and same thing. We will enter the first name and last name and the other information that is necessary to start EEG. So when you start your EEG, it can be showing your workspace, which is this. This is my workspace. So if I don't want the annotation viewer, I can just close it and just focus on my friends. So before we begin the recording itself, we need to configure what we need. So we go to Edit, Settings. And the first step is to create a analyzer profile. So to create an analyzer profile, we go to the Options and Analyze tab. So creating a new profile or using an existing one and edit from there. So in this demo, I will show you to create a new profile. So you click New Profile and you choose a name. So for example, I see you. And we have the head box. So I'm using Brain Monitor right now. I'll use Brain Monitor. And montage, you can choose as recorded. And over here is your analyzer panel. You click Add, and this is the list of analyzers you have. So I can choose AEG, quantitative EEG, DSA, Excel event, and perhaps also Excel spike. So when we choose our analyzer, they will also need you to select the channels that you want to analyze. So by selecting the analyzer, it will bring you a channel panel over here. So you can add or remove accordingly. So you can choose your montage. So I'm gonna choose AP bipolar and select the channels that I want to analyze. So the more you select, the bigger the file will get. So just for demo purposes, I'm going to select all of them. And the same thing for DSA. So DSA is slightly different. You don't use the same montage, but you need to take note that you should be choosing the reference montage. So reference or BM, and the input should be single. So if you don't select any inputs, the system will automatically use the first 20. So if you know what you want to analyze, you should choose it, click OK, and it will appear over here. So at any point in time, you can also remove if needed. Over here, you have your study type. So you can either right click and choose, or you can just click study type and choose. So if I only want EEG, I'm not using sleep, I can just choose all EEG. So once you're done, you should also take note that your activation should be selected as always. So this means that when you record online, it will also do the analysis together. If you choose never, it will not analyze during recording. So you always need to do offline analysis, which I will show you later on. It's called batch analysis. So the recommended setting would be always. And when you're done, you can save as common or local. So common is for a few systems sharing the same network. So you save once and it will be included in other system. If it's local, it's just this one and only system that you are saving to. So I'm going to save as common and select save. So your analysis is done. So I'm going to click OK and start recording. So when you start recording, you'll notice that my analyzers will also be shown here in the annotation, what is being analyzed, what's going on. So while analyzing, you can also configure the trend profile. So same thing, edit settings, go to trends, and create a new one. So I'm going to do ICU. And similarly, you can choose what trends you want to trend. So the axis, I prefer to use both. And over here is what's being trend. So for example, I'm just going to choose a few. And this is what I want for my first tab. If I want to add additional tab, I just need to go to number 2 and repeat the process again. So now I want to include DSA. So you'll notice that over here, will not show DSA until you configure it in the DSA plot. So when you click the DSA plot, it will come up with a window and you need to choose your input. So similarly, your active channel and your reference channel. So I'm going to choose a couple of channels.
Enough. I think there is no sound.
Sorry?
There is no sound from your.
Can you hear me now?
Yeah, I can hear you now.
Okay. So which part do you need me to repeat? Is there any specific portion you need me to repeat since you couldn't hear me earlier on?
There is no need. Just sleep because we still seeing the picture. So just continue.
Okay. So once you're done configuring the channels, you can click OK. And your window should include the DSA that you just configured. So same thing, you click. And if you want to arrange the sequence, you can always use the arrows over here. And if you want more, you can do a tab tree as well. So over here, I don't have a QEG, and I will go to the QEG window and choose what I want. So over here, they have the left side absolute. You can choose the type and edit when you double click it. So I'm not going to make any changes. These are usually the standard, and I recommend you to use the default settings. So once you're done, you click OK. And I can include the QEEG. So I have the relative power left and right and the absolute power left and right. So same thing, once you're done, save as common or save as local. So once you're done, then you can click apply and OK. So over here, you see it's still showing EEG only. You need to bring out the trends summary. Right click on the mouse and you will see trend summary, click show, and this is what you should see. We have a few options on your position. You can either let it be at the top, bottom, left, or right. So I like it on the right. And this is my new workspace. So if I like this workspace, I can go to workspace icon and save as. So you can save as ICU, similarly common or local. So I'm going to save as common. So this is how you do configuration for your analyzer's profile and also for your trends profile. And to move to a different level after this is to look at acquisition profile. So acquisition profile, we will look at the edit settings again, and we go to the acquisition tab. So acquisition profile allows you to introduce automatic actions like start data recording, start video recording or restart studies or whatnot. So this is actually very useful in terms of long-term monitoring. So if I record for maybe one whole week, you want the study to be break into 5 or 7 studies. So you can choose the timing. You can either every 24 hours. So if I start right now, tomorrow, 3:48 p.m., it will automatically start again. If you don't want, you always want to be fixed at a certain timing, like for example, 7:30 a.m., you can choose this setting and the same thing happens. It will automatically close and start the study again. So on top of that, you also get to choose to run a specific protocol, for example, channel test or channel test with impedance check. So you can introduce all these automatic actions, which simplifies the entire workflow for the users. And your default montage as well, which one you're using. So if it's a pediatric, you should choose neonates or a PEDS montage. And for adults, we should be using the AP bipolar usually. So now we look at the acquisition profile. Over here, I have the LTM settings. So if I want a new profile, I can either edit from the existing one or just create a new one. So I'm going to create a new one and say ICU. And earlier on, I did a new profile for the analyzers, ICU, and for the trends, same thing, ICU. Click apply and OK. So this is acquisition profile. Okay, next, before I move on to the next segment, is there any questions regarding these settings?
Yes, Nina, I have one question for the profile. Before that, you mentioned about the analysis profile and then profile. Is it for that profile is depend on the doctor, or there is a default setting in the NeuroWorks?
Yeah, talking about which profile again?
Two of them, the analysis profile and trend profile. Is depend on the doctor, or there is a default template or maybe default setting from the NeuroWorks software?
So for the analyzer profiles, we have some default settings over here, like for example, the latest brain monitor. So when you connect your headbox to it, these profiles will appear. So you can use the default provided by the system, or you can create one profile that the doctors want. Does that answer your question?
Yeah. Okay. So there is a usually, because if doctor doesn't have a preference setting, so we just use this setting, right, for the default.
Yes, you can use the default settings, but always good to know what the doctors want. If they don't know what they want, you can always just add all the channels as required. So over here, the default setting is actually showing these channels, which is not enough. So I would suggest to add more channels. Is it okay?
Okay, thank you, Mia.
Yeah. Okay, so I'm going to stop this recording and show you a different interface, which is the ICU touchscreen. So before starting the EEG, we go to the tools and options. And over here, we have the ICU touchscreen mode. So you can choose this. And if you purchase Persist, you can use the Persist. If not, you can use the latest trend summary. So this one is a automatic action as well. So for example, it is recording raw EEG data only, and it will automatically switch after 1 minute when you don't touch the laptop or the desktop. So for demo purposes, I'm just going to change it to 10 seconds so that you can see how it works. So click apply and OK. So same thing, click new EEG, and you will notice that the study information is actually simplified. So click start. And this is how your interface will look like. On the left side, you have large icons. So if your monitor is actually touchscreen compatible, you can just touch the screen without using the mouse, and it will switch the panels from icons to icons. So over here, to start the recording is shown on the controls. So it's already recording. So just like I mentioned to you, if I don't touch the laptop or the desktop after 10 seconds, so now I'm not touching my mouse at all, it should automatically switch to the trends summary. So if you don't touch the mouse, sorry, so if you want to see the trend summary immediately, you should click the trends. And if you want to show both, so on the live segment, you need to right click and show the trend data, and you can see both. So it's the same thing as how you would use your usual acquisition in the normal mode. You can either drag or right click. I prefer to use the mouse and change the position. So these are the common tools that we have, the impedance check, the video, and how you want to adjust the camera. So after recording for a while, you will notice that your trend scale will show, will not be grayed out anymore because there is some data recording, and they allow you to change the time scale. So I'm gonna change it to 1 hour, and you will see that there is some difference. Another way to change it is to right click on the window, and you can set the time interval over here. So these are how you can use this interface. We try to minimize the number of things on the window and only show the bigger icons over here that are commonly used. So this is pretty much how the ICU touchscreen mode works.
Hello, Nina.
Yeah.
So this one is display for the is make for the display that using the touch screen, right? For this one, for the second monitor, right?
It can be used on a normal screen as well. It doesn't have to be touch screen. The touch screen is to allow the users to press the buttons on the screen to change it without using the mouse. So that's the main difference.
Okay. So, but this is not in the main monitor, right? It's in the second monitor.
No, it's the main monitor.
Oh, it's in the main monitor. Okay.
Yeah, it's the main monitor that you're using. It can be a laptop, it can be a desktop.
Okay. because we always open, but there is no icon in the left side. It's like live, review, and plan scale like that. How gonna do show that icon? It's
This
make
one?
like yeah, that part. Yeah.
Yeah, so just now okay, let me close this and then show you again how to activate it. So you go to Tools, Options. Over here, you have the Use ICU Touchscreen mode. You need to select this before recording and then choose Latest Trend Summary.
Okay.
And you can select the time for inactivity. So I'm going to choose 10 seconds. You click Apply and OK. So I'm going to click New EEG now. And I can start the EEG. So it will automatically show the icons on the side.
Oh.
Yeah. So now I can use this surface on a normal monitor or a touchscreen monitor.
Oh, okay, Mina.
Yeah. So if you have the touchscreen monitor, the users can use the touchscreen to activate and change the panels accordingly.
But
Yeah.
for the trend profile, that we must make it first, right? For the trend profile.
Yes, the trend profile and the analyzer profile, you should configure it. You can do it during the recording itself or before the recording, you can configure it. So just now you saw the screen automatically change to trends without me touching the buttons at all. This is the 10 seconds of inactivity. That's how it works. Did you understand that part?
Sorry,
So
so
now
can you repeat again?
So now I'm in the live EEG recording. I'm not going to touch my mouse or type anything. After 10 seconds, it will switch to the trends window.
Okay.
Can you see it just switched?
Yeah, it switched to the trend profile. Yeah.
Yeah, so this is good in a sense whereby there are a lot of people looking at this EEG. So for example, I'm the doctor, I come here, I want to see what's going on in the EEG data, and then I forget to change it back to the trends panel, which is what the ICU people would like to look at. So this feature will allow the system to auto switch to the trends. So it is useful in this way. Okay?
All right. Okay, thank you.
Okay, good. And when you use this touchscreen mode, you need to take care of the trends profile that you are using. You can only configure this profile, ICU waveform, and select. You cannot create a new one and choose a different one like LTM, NICU. It will not use this profile. By default, you only can use these three in this mode. Is it okay?
Okay, that's fine.
Okay, good. So I'm going to exit and then we can look at the offline analysis. So when we do offline analysis, we can look at the latest database. So when we run the recording over here with the online analysis, the icon over here is still a waveform. When I do the offline analysis, it will change to this icon with the letter A. Can you see?
We can see.
Okay, good. So I'm just going to choose one of the studies to do the offline analysis. Select the study, click Analyze, and you choose the profile that you want to use. So I'm going to use the LTM, and you can either choose all default or on or off, or you can select some. So you just need to uncheck it. So this is how you can use the batch analysis, which is also the offline analysis. So if you have more analyzers and more channels, the analysis process will be slightly longer because you are introducing a lot of analyzers, and the system needs some time to analyze everything. So if your study is like 24 hours and you have like maybe one or two analyzers with only 2 or 3 channels to analyze, it can be longer because of the long duration of recording. So there are 2 factors for you to take note. Is either the duration of the study is too long, or the number of analyzers you have is too many. So these are things that you have to take into consideration if customer asks you why the offline analysis is taking so long. So in this example, I chose all the analyzers, and I have a lot of channels as well to analyze. Even though my recording is also very long, it's 7 hours. Okay, so in that sense, I'm just going to stop and switch to a shorter recording.
Okay.
Okay, let me choose a shorter recording. Okay, this one is quite short, 9 minutes. I can also select just PNG, yes, an envelope. Okay. Okay, so when it's done, it will allow you to close it, and you will see that this icon has a letter A. So I can open it and look at the trend summary. So same thing, you have to open it and do some configuration. So this is configuring after the recording. So you can choose your existing ones, or you can create a new one. So I click OK, and this is my trend. You can switch from tab to tab. So earlier on during the PowerPoint presentation, I talked about the single click quick access. So I just need to click on one portion of this, and it will bring me to the corresponding EEG page. So if I click to a different place, and it will switch. So this is how useful and efficient the trending summary can be. And if you like this workspace, you can save it again. You can save it as ICU, or you can choose a new one, for example, Dr. Lee. So Dr. Lee likes this workspace. So whenever Dr. Lee comes and review EEG, it can be like this, and all they need to do is to switch to their own workspace. So this can be configured in a way whereby it personalizes each individual, and it applies to the same thing for the acquisition as well. Any questions?
Okay, just one question, and so before that, you can change the analysis profile for one patient, right? So, is it possible to move patient data from another unit to this, let's say, this entrance unit, and then we check the analysis profile using the entrance? Is it can be read in this unit?
Are you asking whether you can use the same analyzer
Yeah,
for the same
or
different
for other
patients?
patient. Yeah, different
Yes.
patient, but from other unit, from other PC, let's say. Yes, we export it. We move to the
Okay.
yeah,
So same thing,
PC. Yeah.
analyzers, when you are in a network, you save as common. When you are in a local, you can save as ICU. Sorry, you can save as a local one system, or you can save in a network. So these
Yeah.
systems need to be connected in the same network.
Okay.
Yeah. So it applies for the trends, for the analyzers. So now it's grayed out because I am not doing a new profile.
Okay.
And for the acquisition system, you cannot save as common. It's only to the single system.
Oh, I see.
Okay.
Okay. Yeah.
And montage, same thing. You can save as a common or local or patient only.
Yeah.
Okay.
Okay.
So any other questions? If you don't have questions right now, it's okay. You can always email me and I will try to help you over the email.
Yeah. Okay. Yeah, I think just continue for now.
We have actually finished the
Oh,
advanced
finish all.
training already. Yeah,
Oh,
so I have shown you the online configuration and offline configuration. It's actually the same thing. You are just in a review mode or the acquiring mode. And I also shown you the ICU touchscreen mode as well.
yes. So can you show us how, let's say that you are the doctor, can you show us how to read the result from the recorded session that using the 8 rand, yeah, using the 8 rand.
Oh, so if you want to export the trend to the report, you can right click on the trend window and do export. So we have a few options. You can copy and paste, which is the clipboard, the JPEG, which is in a picture. You can save all of them into a picture, or you can export the graph or the graph data. So these are the 5 options you have.
Okay, thank you. Then not what I mean, see, how about how to read that this part, the entrance is out, this result from the recording session, right? That like
What do you
if the
mean?
doctor the doctor ask a question about the how do we explain the doctor that this is a result from the entrance profile. How do we say to the doctor that this is the result from the entrance? Can you maybe make a example from your side, maybe?
Sorry, I don't quite understand the question. You're asking how to explain to the doctor that this is the trend
Yeah,
result.
yeah, yeah, yeah. That's it. That's what I mean. Or do we
Is it
explain the doctor
because the
that
doctor don't know how to read the trend?
because I think there's one doctor that using for the first time using the end trend session.
Okay. We
Can
have
we
some
explain?
examples to show them, but not exactly telling the doctor the result of the trend summary. They have to learn how to read. Like just now in the PowerPoint slide, I've shown you some examples how certain patterns look like. So the doctors need to get themselves familiarized how certain patterns look like, and always going back to the corresponding EEG to verify that there is a seizure or is it an artifact.
So we just show the doctor for the trend in the like part, right? In the edit, export to the GPT before.
Yeah.
So yeah, we saw the doctor result from the entrance, right? We just show it.
Uh, Simone, you have something to add on?
Hello, everybody, and thank you, Mina. I'm not sure I am getting the point in the best way, but if the question is, how can the doctor get clinical experience on interpreting the trends, I can give two different suggestions. Number one, there are very nice literature publications, books, and articles that we can provide you references to that are really associating specific patterns of trends to specific clinical cases. Second point, I would recommend the doctors to attend several of the webinars that we are having on Native Training Academy. As an example, there is this evening one webinar exactly on quantitative EEG trends and the usage on different cases from a clinical standpoint. It is in Spanish, but it will be subtitled, and we will also publish this in English in a few weeks. So really, the Native Training Academy website is very good in terms of webinars where people can really, especially clinicians, can get a good understanding on the clinical component on trends. The other opportunity is literature, books and papers, and we can address you with some of this material.
Okay, okay, that's very thank you. Yeah, I think we will see in the seminar also, so we can show the doctor that this is the EEG one before, like the example.
Yeah,
Okay.
thank you so much, Simone, for your input. Anything else, Ricky?
Just wait. I will answer my thing first.
Chichong, do you have anything to add? Thank you for joining us today.
Yeah, so I guess we can also send you the Natives Training Academy website, Ricky. Yeah, I guess we have sent you before, but maybe you have overlooked it. Yeah, I'll send you again, in the email, and then you can actually look at the resources that are all published on their website. It will give you a lot of inputs and knowledge on this question that you're asking. Okay, Ricky?
Okay, yeah.
Okay,
Alright.
I'll send you the website. Yep.
Mina,
Yes.
can you know the reports EEG?
Maybe is there this example of the report from maybe Word that so that including the AG trend from the report, patient report?
Okay, let me check. I don't usually generate report with the trends. So let's try and create a report template, we go to Tools and Options. So under the reports template, so under EEG, we can create a new one. So we have the Excel fields over here. So when you want certain information, it would be under plot. So let's say I want the AEG, the DSA. So I'm just going to omit the patient information and just show you the plot itself. And maybe also the trends summary. So once you're done with what you want, you can save it. And then I'm going to close this and generate a report. So this is my template. And it will show under the user report template. I click OK, and I go back to this patient and right click, study report, and create report. So you can either choose the default report templates or to use your own. So now we want to see the EEG with the trends. So I'm going to click report and let it generate. So this is how the trending summary would appear. So if you have analyzed what you need, and then you can select the plots and change the size to make it more visible. So this is how a report can look like with the extracted data. So if you don't want a report like this, the other option is to really just export the data immediately. Okay, so if I want to do that, I'm going to open the EEG with the trends. So export plot, I want it to be copied to clipboard. Then I go back here and I paste it. So this is another way of doing the data export, extracting the summary data into the Microsoft Word report. Because when you do the extraction, it's everything. If you only want like specific channel, you have to do the manual way, which is copy the clipboard or copy all of them as an image. Then go back and insert it as an image. Yeah, so this is the few ways you can do the reporting with the trend summary.
So it must be up manually, right? Or make just
You
one
can do the
one by one.
automatic extraction, which is creating the report template, or you can do the manual one, which is copy and paste, or save them as image and insert as a picture.
Okay.
Okay?
Yeah. Okay. Thank you, Mina.
Okay, great. So if there's no other questions, I can stop the recording and send it to you. You can always review it again. If you have questions, just let me know via email. I will help you.
Okay. Okay. Yes, we will think for the link that we will review for the study.
Okay, thank you so much.
Yeah.